Okay, welcome everybody. So, continuing with the psychiatry lecture series, today we are going to discuss the classification in psychiatry. So, what are the psychiatric illnesses and how do we classify? Classification is a process by which phenomena are organized into categories so that we can bring together those phenomena or those symptoms that resemble each other and to separate those that differ. So, very simplistic terms, classification means all similar illnesses or similar symptoms are clubbed together in one, and the different ones are clubbed together in separate classifications. This helps us in being very organized, and as students, it's easier for you to learn, and as clinicians, it's easier for us to diagnose also. So, classification is very, very important. And see, we are sitting here in India and we are diagnosing. But somebody who's sitting in the UK, in the US, or in Japan, all of them should be able to make a same diagnosis of the patient. It shouldn't be like the diagnosis is differing according to the region or according to the doctor. That is why classification is also important. And any classification of psychiatric disorders, just like any mental disorders, should be based on etiology ideally. But for large majority of psychiatric disorders, there is no distinct etiology. Especially in the previous years, we didn't know the cause. So then again, classification was a challenge, and of course, then there was a lot of probabilities also. Like, then what can we base the classification on? Therefore, the most rational way to classify was syndromal. Syndrome means a collection of symptoms. Okay, so based on the symptoms and based on the syndrome, we then classified the psychiatric illness. So, syndrome is defined as a group of symptoms and signs that often occur together and delineate a recognizable clinical conditions. So we have a lot of syndrome like Down syndrome and also these are all basically classification of signs and symptoms. Now this syndromal approach of classifying psychiatric disorders on the basis of their clinical signs and symptoms is very similar to the historical approach of classification of medical illnesses when etiology was not known. So yes, even medical illnesses previously were classified based on syndrome, and now current classification of psychiatric illnesses is again syndromal. Maybe in future, maybe when all the etiological phenomena will be known for all psychiatric illnesses, maybe our classification might change. But currently, we classify it based on the syndrome. There are three major purposes of classification. One is to enable the communication regarding the diagnosis of disorder. Second is to facilitate comprehension of the underlying disorders. I'll explain what all these are. And to aid in the prediction of prognosis. Okay, so to enable communication means patient has come to you, patient already has hypertension, diabetes, and now the patient has depression also. So this diagnosis helps in communicating with other doctors also. That this your patient who is already on these medication will now be taking a medication for depression or is diagnosed as depression. So this helps us in communicating with other doctors or communicating with other people who want to know about the diagnosis. Or just telling the history is very time consuming, especially in psychiatry. The history might be 8 or 10 pages. So the other doctors will not sit and read those 8 pages. If they can just read what the diagnosis is, it's a very quick and easy communication. Second is to facilitate understanding of the underlying causes of these disorders. Once we know the syndromal classification, then we can go into the details like what is causing the depression, what can be the cause of depression. So once we know the diagnosis, we can go into the causes, and last but not the least, it helps us in the prognosis also. Because the next question that the patient or the relative will ask is what is going to happen next. Like, will I be okay in 3 days, in 3 months, or 3 years? तो दैट इज अ क्वेश्चन कि डॉक्टर साहब मुझे कितने दिन तक गोली लेनी पड़ेगी, मैं कितने दिन में ठीक हो जाऊंगा, या मैं कितने दिन में अपने काम पे वापस जा सकता हूँ. तो ऑल दीज क्वेश्चंस कैन बी वेरी इजीली आंसर्ड if the patient is classified into a single disorder. Now, just definition of psychiatric disorder. So, the simplest way to conceptualize a psychiatric disorder is there is disturbance in cognition. Cognition means thought. Then disturbances in action and affect. Affect is your feeling or emotion or any disequilibrium between the three domains. So whatever disorders we have are permutation and combination of all these three things. The thought, the action and the feeling or the emotion. However, this simple definition is not very useful in routine clinical practice. So another way to define a psychiatric disorder is clinically significant psychological or behavioral symptoms or syndromes that cause significant distress. So distress can be to the patient or to the relatives or to others. So is it subjective distress, objective distress, or some disability that the patient is not able to do their work or day-to-day functioning, loss of freedom, and not merely a social deviant behavior, or expected response to a stressful life, like loss of loved one. Let me explain what this big line is. Don't be scared of big words. Basically, what we want to say is yes, there are problems in cognition or action or emotion, but apart from this, there should be some distress to the patient or some distress to the relatives. If there is no distress, there should be some disability or loss of freedom. And this should not be a socially deviant behavior. So some people are, yes, very disrespectful or very irritable, or they might be angry by way of their personality. So just being an angry personality is not a psychiatric disorder. Or just being sad because there is a death of a loved one. Again, you can't call it as a psychiatric disorder. It is normal grief. If somebody close to you dies, you are supposed to feel sad. You are supposed to feel depressed. So this is very, very important, especially in the context of psychiatry. Because the main question which a lot of people ask is, how do you differentiate between normal people and psychiatric people? कि आपको कैसे पता चलता है कि normal कौन है और आपका patient कौन है? This is a very valid question and a very common question. So these are the points. These are scientifically proven points which will differentiate a normal person from a psychiatric person. So what are these points? Distress, disability, loss of freedom, and this should not be a socially deviant behavior, should not be response to a stressful life event. So all these criteria, if they are being fulfilled, then only we define it as a psychiatric disorder. So conflicts between the society and individuals, they are not considered as a psychiatric disorder just because कि वो society के according नहीं जी रहा है, या society ने जो rules and regulations बनाए हैं उसके accordingly कर रहा है, तो you can't label that person as a psychiatric disorder. Psychiatric diagnosis is a very serious diagnosis. It has a lot of implications. Patient के भी mindset पे, relatives के भी mindset पे. So don't use psychiatric terms very loosely, or don't be in a hurry to make a psychiatric diagnosis. A psychiatric disorder should be a manifestation of behavioral, psychological, or biological dysfunction in that person. So this is according to DSM-4-TR and the American Psychiatric Association. So again, for the psychiatric disorder, we need permutation combination of behavioral, psychological and biological dysfunction. ये तीनों के combination देंगे हम कोई psychiatric disorder बोलते हैं, ठीक है? And although slightly lengthy, this definition defines the psychiatric disorder more accurately. So the previous slide and this slide in combination will help you in making the diagnosis of any psychiatric disorder. So next time whenever you see a psychiatric patient, whenever you are diagnosing a psychiatric patient, make sure all these criteria should be fulfilled. And this is a general umbrella term for all psychiatric disorders. So we are going to see specific diagnosis according to the disorder, but in general, any psychiatric disorder should fulfill at least all these criteria. So always keep it in mind. This is very, very important. And before making a diagnosis or before calling somebody abnormal, you should know what is normal. जब तक आपको normal क्या है ये पता नहीं चलेगा तब तक आप abnormal कैसे decide करें? So again, normality in mental health is very, very important. So WHO has said that health is a state of complete physical, mental and social well-being. So it is not merely an absence of disease or infirmity. So this is the most widely used definition. If you go in medicine, surgery, everywhere, this is the definition of health that is used. This is a definition by WHO, and I'm very happy that they have included mental health also. So for health to be said, it is not just physical but mental and social well-being also. So even WHO recognizes psychiatric illnesses whenever you are defining the concept of health. So normal mental health, much like normal health, is a difficult concept to define, but let us try and attempt to define it. So although normality is not an easy concept to define, one of the traits which can be used or commonly found in normal individuals is one, reality orientation. So reality orientation means कि उनको पता है कि रियल क्या है और फेक क्या है। जैसे आप मूवी देखते हैं तो आपको पता है कि ये रियल नहीं है। So movies are not real, your dreams are not real, or you're daydreaming in a class, you know that it is not real, ये असली में नहीं हो रहा है. So this is reality orientation. So this is the first and most important thing. Second is self-awareness and self-knowledge. कि आपको खुद के बारे में अवेयरनेस है कि मेरे स्ट्रेंथ्स क्या है, वीकनेसेस क्या है. You know about yourself, you know you are having a headache and you know you are feeling tired. So having an awareness about yourself is important. Self-esteem and self-acceptance. Self-esteem again, that what you really are. Again your strengths and weaknesses. So you know that I'm not good in maths and you know that I'm good in maybe English literature or science. So you know your strengths and weaknesses and you accept those strengths and weaknesses. So this is self-esteem and acceptance and ability to exercise voluntary control over your behavior. So yes, you are having thoughts that ये तो lecture बहुत बोर हो रहा है, मैं तो जाके घूम के आता हूँ या मूवी देख के आता हूँ. But you are able to control that behavior. You know that you will get scolded by your teacher, you will get an absent in your class, and then you have to face the consequences. So you are having a voluntary control over your behavior. So again, this is normal, or this is what is considered as normal. Ability to form affectionate relationships. So this It's again a very umbrella term, so ability to form friends or having good relationships with your teachers also. So this is again fifth point in normalcy. And last is pursuance of productive and goal-directed activity. So productive activities can be anything from making tea in the morning to studying, or if you have decided that I will finish this chapter today, when you are finishing that chapter, then it is a goal-directed activity. So, doing productive and goal-directed activities, this is also normal. And I know these points are very obvious, or you feel that what are these points even there? But some of, or most of the points are hampered in psychiatric illnesses. So, a lot of things that we take for granted in day-to-day life are actually disturbed in psychiatric patients. So, this was your concept of normalcy. Now, coming to the actual classification. So, let us dive into the classification. Like any growing branch of medicine, psychiatry is seeing rapid changes in classification to keep up with the growing research data, the epidemiology, symptomology, prognosis, treatment, and sometimes we have new theories for causation of psychiatric disorders. So yes, there is a lot of research going on and a lot of new things every day we are finding about psychiatric illnesses. And because of this, classification also keeps changing. Like the current classification which is there is ICD-11. ICD-11 is the latest classification. So previously there was ICD-10, but now we are moving into ICD-11. So every 10 years or so, the ICD International Classification of Diseases is updated with newer things, and ICD is followed all over the world. So not just here, but we use it for diagnosing all of illnesses and all over the world. DSM is your diagnostic and statistical manual. So DSM again, the latest version is the fifth version. So it started with one, then two, three, four, and now five. DSM is used mostly in the United States of America. So they have their own classification system, which is DSM 5. But most of the world uses ICD 11. In India also, we are using ICD 11. So, although first attempts to classify psychiatric disorders can be traced back to Ayurveda and that too in the 4th century BC, but it has evolved. We don't use those classifications now. We and you also as students should use the latest classification, and you should be up to date with the latest happenings which are going on. So knowing history is yes important, but knowing the recent data is also very important. So ICD-11 actually is very new, and the drafts are still coming. So I think it is better that you learn about ICD-10, because ICD-10 is easier to get hold of also. ICD-11 आप गूगल पे अगर करेंगे तो वो कभी कभी मिलती नहीं है, कभी कभी पुराना वाला या रफ ड्राफ्ट होता है. So ICD-11 you can find very easily. So ICD, International Classification of Diseases. So this classifies all illnesses, not just psychiatric illnesses. So infectious disease, surgical illnesses, all are classified. So it has a lot of chapters. So the chapter F deals with psychiatry. Now in chapter F also, they have divided it into sub-classifications. So F00 and from F00 to F09 is your organic illness. So whenever we are diagnosing somebody, we write a code, and this code is the ICD code. So for example, a patient comes to you with delineate. So you can just diagnose that as F00 or F09, and the doctors and everybody will understand that this is a organic mental illness. So the first S00 to 09 is your organic illnesses. It includes delirium, dementia, organic amnestic syndrome, and other organic mental disorders. Okay, now coming to the second point. S10 to S19 is all your addictions. So addictions in clinical or technical term, they are called as mental and behavioral disorders due to psychoactive substance use. I know it's a very long name and it might look very complicated, but it is just what day to day we see addiction or addictive patients have. So in addiction, you can have acute intoxication, harmful use, dependence, withdrawal, then amnesia can also occur. Sometimes psychosis occurs due to psychoactive substances. So psychotic disorders due to psychoactive substance will come under here. Okay, so we have 9 types of substances which people use. So F10 is your alcohol. तो अगर कोई अल्कोहल डिपेंडेंस सिंड्रोम का पेशेंट आपके पास आता है तो यू विल मेक अ डायग्नोसिस ऑफ F10. Okay, and it is understood that it is mental and behavioral disorders due to alcohol use. Okay, so this is how it goes. S20 to S29 is all your psychotic disorders, so schizophrenia, schizotypal delusional disorders, and then we have persistent delusional disorder, acute and transient psychotic disorder, and induced and schizophrenia. So all these come under your F20 to 29. Then F30 to 39 are your mood or affective disorder like mania, depression, bipolar affective disorder, recurrent depressive disorder, and persistent mood disorder. Okay, so just having a overview of what disorders come under what classification is important. F40 to 48 are your neurotic and stress related disorder. तो इसके अंदर आता है all your anxiety disorders, phobia, obsessive compulsive disorders, somatoform adjustment. So all anxiety will come under F40. S50 to 59 is behavioral syndrome associated with physiological disturbances and physical factors such as eating disorders, non-organic sleep disorders, your sexual dysfunctions. Sometimes after pregnancy, some disorders occur then also. This will come under this. And any non-dependence producing substances will also come under this disorder. So other addictions can also come in this. Now comes your S60. So S60 are your personality disorders. So personality disorders can be again a long list. I won't go through all that. But sometimes gender identity disorders can also be classified into this as 70 to 79 is your mental retardation. 80 to 89 is other disorders of childhood. तो बच्चों में जो बाकी disorders होते हैं जैसे autism हो गया, school problems, motor problems, cognitive development disorder. So all this will come under F80 to 89. 90 to 98 are again childhood वाले जो आते हैं. So इसमें conduct disorders, tic disorders and other आते हैं. And if you are not able to understand या आपको clear history नहीं मिल पा रही है, so then you can classify it as unspecified mental disorder. तो जो भी disorders जो classify नहीं हो पा रहे हैं या जो diagnose नहीं हो पा रहे हैं, इसका मतलब यही है कि उनको कोई कोड नहीं है. तो कोड S99 is unspecified. So again, if you will see ICD-10, yeah, if you will read it in your books or if you will Google it, इसके भी अलग-अलग types आते हैं. ठीक है? First type is your clinical description and diagnostic guidelines. ठीक है? ये वाली जो है वो हम लोग यूज करते हैं day to day basis में in our OPD, in our wards. What we use for making a clinical diagnosis is CDPG. Okay. But somebody comes to you and says that I want to do some research in psychiatry or I want to do some thesis. So you can't use a clinical classification because those classifications are used for diagnosis and treatment. But research point of view, say if you want to use or classify a patient, then it is DCR. So DCR is diagnostic criteria for research. Okay. एंड एक आता है प्राइमरी केयर वर्जन तो बहुत सारे पीएचसीज पे और छोटे छोटे प्लेसेस पे साइकियाट्रिस्ट नहीं होते और या स्पेशलिस्ट डॉक्टर्स नहीं होते तो देन प्राइमरी केयर वर्जन इज द इजियर टू अंडरस्टैंड वर्जन and multi-action classification. Multi, what it is, I'll just tell you in the next slide. So earlier classifications in psychiatry were based on hierarchies of diagnosis with the presence of a diagnosis higher in hierarchy, usually ruling out all lower. I'll explain what this is, okay? I know this is again a very heavy term, but what had happened was that if a patient comes to you, patient has psychotic symptoms also, patient has depressive symptoms also, and patient has anxiety also. अब अगर patient has all three of these things, what will you diagnose or how will you diagnose? Because a lot of times patient will not have a clear-cut ICD diagnosis. Patient will have mixed features. So what used to happen in previous times, पहले के टाइम पे क्या करते थे? एक हायरार्की होती थी. So most important to least important. ऐसी हायरार्की होती थी and whatever diagnosis was in the higher hierarchy, like psychosis was much more severe or serious. So psychosis was in a higher hierarchy, anxiety was in a lower hierarchy. So then what would people do? They would be like कि हम psychosis का बना देते हैं, anxiety, depression सब जाते. Okay, so diagnosis of lower hierarchy was just ruled out. But this was felt to be in keeping with teaching of medicine at large time, and emphasis was making on a single diagnosis. ठीक है, rather than explaining different symptoms and different diseases. तो उनका मानना ये था और what we wanted was that we want a very single diagnosis, so that is why they ruled out all others. But the current classifications, these encourage multiple diagnoses. Because see, a patient with, like I told you in the starting of the lecture, a patient with hypertension can develop depressive symptoms also. तो इसका मतलब ये तो नहीं है कि उसको हाइपरटेंशन है तो डिप्रेशन नहीं हो सकता है या डिप्रेशन है तो हाइपरटेंशन नहीं हो सकता है ना डिफरेंट क्लासिफिकेशन हो ही सकता है सो दैट इज व्हाई नाउ वी मेक मल्टीपल डायग्नोसिस कोई कंफ्यूजन नहीं है patient can have separate diagnosis so although a diagnostic hierarchy makes clinical sense consideration and recording of comorbidity is helpful in identifying patients' needs. For example, comorbid anxiety disorder with bipolar disorder helps identify and treat anxiety components also. So, if a patient has multiple problems and multiple diagnoses, we are supposed to make a diagnosis and treat them. ऐसा नहीं है कि हमको एक ही बनाना है तो बाकी को छोड़ दो या बाकी को इग्नोर कर दो. So make multiple diagnoses. That is what we want now. Last, just stay with me. I know this is a very heavy subject. This is the last concept of multi-axial classification. So the process of making a correct diagnosis is very useful clinical exercise. And हमारा main aim होता है to make a correct diagnosis. However, sometimes making a clinical diagnosis can lead to labeling of a patient, and this labeling can lead to stigmatization. And patient can become just another case. So patient को direct attention नहीं मिलता. So the patient does not get attention as an individual. They get attention as a diagnosis. And then we treat it as a case of depression or a case of anxiety. So that is why multi-axial classification came, because we want to make multiple diagnoses, but we want to be clear and we don't want to create confusion also. So in this situation, we came up with a multi-axial classification. So इसमें हमने 5 axes ली. There are 5 axes. Axis 1 is your clinical psychiatric diagnosis. So for example, anxiety or depression. So this will be your axis 1. Axis 2 is personality and mental disorder. Axis 3 is general medical conditions. So again in that patient, जो hypertension था वो आएगा axis 3. So hypertension and other medical illnesses will come in axis 3. Axis 4 is psychosocial and environmental problems. So patient के घर पे family problems चल रहा है, patient is going through a divorce or other problems. So all these will come in axis 4. Axis 5 is global assessment of functioning. So current and past functioning उसकी कैसी है? Because functioning is also important. अगर patient को depression है पर वो काम पे जा रहा है, function कर रहा है, तो then that is fine. If the patient has no problem, if there is no problem in functioning, so should we treat it or not is also a question. So that is why axis 5 is your global assessment of functioning. So this is your multi-axial classification, and this was usually used in DSM-4. In DSM-5 we have removed this multi-axial classification, but still a lot of doctors, a lot of psychiatrists especially are using this because this is a very helpful and a very comprehensive way to describe a patient. आप अगर patient को ऐसे में describe कर देंगे तो कोई doubt ही नहीं है. Your diagnosis will be crystal clear, कोई point miss नहीं होगा और patient भी खुश हो जाएगा because treatment भी फिर अच्छा होगा. So this was the 5 axial classification, and with this we end the lectures. Thank you so much for listening, and I welcome questions if any of you have any doubts.